Hello, my name is Kelly Nelson, and I'm a student at the University of Kentucky. This presentation is for IEC 522 with Dr. Leanne Jung. Today I'm going to be talking about the Fragile X. Fragile X is a genetic condition that affects the X chromosome. It's a mutation of the chromosome which causes mental impairment. It is the most commonly inherited cause for mental impairment. It affects 1 in 3,600 males and 1 in 4 to 6,000 females um, are affected by this mutation. The name Fragile X came from when looking at the X chromosome. Scientists, when they will look at it, will see that it looks like a little piece is hanging off the end of it, which is where it got its name for Fragile X. Fragile X does affect males and females, but not equally. Females tend to have less severe mental impairments than males do. This is thought to be because a female will have 2 X chromosomes. And the chromosome that is not affected by the mutation seems to compensate for the abnormality in the other one, which results in a less severe impairment. Characteristics that are seen in people affected by Fragile X, sometimes the physical signs will not occur until later in life, but that can be a long face, pointed chin, large ears, flat feet, ear infections, hyperflexible joints, and skeletal problems. A lot of people with Fragile X, actually 1/3 of them will also have some degree of autism. And Fragile X is the largest known cause for autism. And 2 to 6% of children with autism, the reason is that they have the Fragile X mutation. Fragile X can be diagnosed by a DNA test that was started in 1991. They can also test to see if you are a carrier of the mutated gene. For a family who has a child with Fragile X, it's going to be necessary that they have a multidisciplinary team working with their child. Usually the first person that will come on board is a speech therapist, because a language delay is usually one of the first things that is noticed. For boys, their pragmatics, which is their conversation skills, tend to be delayed. The therapist really must take an integrated approach to therapy, because there's lots of factors that are going to affect their language. Their motor, especially their oral motor delays, also attention problems, and also just and social interpersonal delays, which is going to affect their language. Girls seem to have better verbal skills, but they have, again, problems with the pragmatics, also anxiety and shyness, and difficulty in social interactions. Common behaviors that are seen with children with Fragile X would be ADHD or ADD, anxiety, difficulties in social situations. Cognitive intervention is very important for a child with Fragile X, and it's also very important for those to start early, and early intervention is just shown through research to really help a child with Fragile X. And also the intervention is found most effective when the strengths and weaknesses of that child cognitively is also looked at, and how it relates to their sensory system, their motor skills, their language, and also their behaviors. And when all of those are looked at together, the therapy is the most effective. Other issues that may come up with a child with Fragile X would be sleep disturbances. This is usually due to the fact that they have hyperarousal and find it difficult to calm down. There are sensory processing difficulties, which means that they are going to be lots of times hypersensitive to touch, to taste, to smell, to textures, to visual stimuli. And so many times an occupational therapist will be part of that multidisciplinary team, and will need to find that sensory diet, which allows the child to finds out what sensory input is needed and how much and when, to help the family deal with those sensory processing difficulties. Eating can be an issue. Um, because of the oral motor weakness. Sucking as an infant may be difficult, so breastfeeding may be difficult, and with bottle feeding, may have to go through several different types of bottles to find one that will work. Then when it comes to eating table food, a lot of times the different textures are not liked by children with Fragile X, and so they may just prefer one texture of food. Um, Also, children will stuff their mouth because they do not feel, because of the oral motor weakness in their mouth, they do not feel the sensation of the food until they gag or they choke. And they have to be taught to chew and to take small bites and to swallow. Dressing can be a difficulty because of the low muscle tone. It's difficult physically for them to dress themselves at times. And also because of the tactile defensiveness, finding clothes that do not scratch or itch, or without tags to bother them can be a challenge for families. Potty training, especially in boys, is usually late. This can be because of cognitive impairment, and also because of poor sense of bodily cues. Um, Females can also have problems with ovarian function, have infertility issues, and may also go through early menopause. The National Fragile X Foundation has some wonderful resources for families. It has a handbook for someone who has a child who has recently been diagnosed with Fragile X. And that handbook will just explain the genetics behind this syndrome, and it will also give symptoms and treatment options. And the foundation really says that genetic counseling is something that is necessary. Because this is an inherited gene mutation, it's important for other family members to know. They could be carriers. But with that, it can become difficult. So the genetic counselors can give tips and just help explain that to families. Um, it's important to know that every child with Fragile X is not affected the same. There's different severities. So it is important for families to also think about long-term care, because some children, as they grow older, will need constant care. So that is another issue that families will have to deal with when they have a child with Fragile X. I thank you very much.